There is not a nursing unit out there that doesn't have 500 things going on at one time. And it's a very chaotic type environment. So pulling active learning into the classroom is doing more than just teaching our students, but it's in fact facilitating them and preparing them for the environment that they're going to enter upon graduation.
Students aren't engaging. Lectures aren't landing. So now what? Active learning might be the answer. And today we're going to talk about how faculty can make it work, even when it feels messy. Welcome to the Lippincott Spark, Illuminating Nursing Education podcast. I'm Dr. Kelly Drees. Join us as we ignite your passion for nursing education and leadership. We'll explore the latest trends, hear from expert nurses, and provide tools to keep you inspired. Let's dive into today's episode and continue your professional development journey together. Welcome. Today we're kicking off part 1 of our series on active learning, and we're starting with the faculty perspective. Active learning isn't chaos, it's controlled brilliance. But for many instructors, it can feel like we're stepping into the unknown. Today's episode is all about why faculty really love active classrooms, even if it feels a little bit uncomfortable at first. We're going to explore how to manage the shift from lecturer to facilitator, how to motivate resistant students, and why active learning taps into the highest levels of Bloom's taxonomy to create deeper, more lasting learning. Our guest today is the incredible Karin Sherrill. I'm super excited to talk to her today. She's a nationally recognized nurse educator, simulation expert, and faculty development leader. Karin brings decades of experience in nursing education and is passionate about empowering faculty to create dynamic student learning environments. Welcome, Karin. I'm so excited to talk to you today.
Thanks, Kelly. I really appreciate you asking me to come to this session today. Thank you.
Let's first kind of lay the foundation. So before we dive into kind of some of the strategies and stories, we need to really understand what really is active learning and why it matters. So let's start by asking, what does active learning mean to you and why is it so powerful in today's classrooms?
It's funny. I had to chuckle to myself as I listened to your intro, because one of the things that you said is that active learning is not chaos, but very structured learning. And I think that's oftentimes confused because active learning can be chaotic. It doesn't mean it's chaos, but it can feel chaotic, especially to the instructor, to the facilitator. And primarily it's because the faculty is no longer in 100% control of the classroom. So it may feel like chaos to them, but in fact, it's a great and perfect environment, especially as we're trying to formulate nurses. Because as you look at the environment that they're going to be walking into as new grads, healthcare is chaotic. There is not a nursing unit out there that doesn't have 500 things going on at one time. And it's a very chaotic type environment. So pulling active learning into the classroom is doing more than just teaching our students, but it's in fact facilitating them and preparing them for the environment that they're going to enter upon graduation. If we keep our classrooms very linear, very structured, students are going to anticipate a perfect outline format when they walk into nursing, and they're not prepared for what they're going to be walking into. So I think it's critical from that standpoint in order to have that level of chaotic environment, putting the emphasis of the learning on the student. That's where the learning is taking place. It's not the instructor giving the information. It is the student who is leading their own learning pathway.
I love that definition. I think about my experience as a nurse educator and leader, and as you probably have seen too, not everyone is immediately on board. Let's talk a little bit about some of the concerns faculty have. There's faculty are really hesitant to kind of give up that control. What do you say to instructors who fear losing that authority in an active classroom?
You know what? It is going to be uncomfortable. And initially, it'll be uncomfortable for you, and it will be uncomfortable for the students as well. But you have to be prepared for that. Knowing that will be uncomfortable, yet being well prepared in order to have a little bit of kickback from your students, have a little bit of discomfort, not feeling like you're giving students the information that they need, but you really have to shift your philosophy. It's not about us imparting knowledge to the students. It's about students learning and understanding, applying the information so that they can learn it at a much deeper level. So what do I say about faculty? Oftentimes when faculty are very hesitant about giving up control, it can be for a multitude of reasons. Number one, I think faculty feel unsure about the information that they're teaching many times. And if they have PowerPoints on a slide, they can simply refer to, they can read if they need to. They feel like they have all the knowledge right here in front of them. So it's a comfort zone for faculty. The other thing is faculty feel that they lose the authority. They lose control of the classroom. They feel like, I'm the teacher, I'm the leader. They see this hierarchy in the classroom. But what we need to do is shift our understanding so that we're not the leader, but we are the facilitator of the students' learning. The purpose of education is for students to learn. How do we facilitate that process and not embark knowledge upon them? We all know that if you're told to do something, you're not going to learn it as deeply as if you do it yourself. And that really is the emphasis of active learning, is getting the students to do it themselves. They are going to do the work. You're not going to be doing the work.
Yeah, he who does the work does the learning, right? So that fear of losing control is definitely real. And it kind of ties to another myth that we often hear, which is if students are enjoying themselves, they're having a great time, they're laughing, they're having fun, they must not be learning. So what's your take on that?
Because the classroom is not structured, oftentimes it comes across as a fun type of environment. And that's okay. That's perfectly acceptable that there is some fun in the classroom. Learning is still taking place because the learning takes place in the person's mind. Now, oftentimes I think faculty equate active learning with gaming. And initially when we started talking about active learning, we talked about putting in Kahoot games or adding some PowerPoint slides, things like that, which is certainly one form of an activity you can put into an active classroom. But if you make it all fun and games, then actually your students are going to be learning at a very low level. When you interject gaming into a classroom, asking Kahoot questions or using a Jeopardy PowerPoint or whatever it is you're doing, those are typically knowledge, low Bloom's level activities. Whereas if I can engage students with active learning, that is maybe an unfolding case study or something that includes or simulates care of a client, then they really are working at that application analysis Bloom's level. And it decreases the quote unquote fun, giggling, laughing, because we in fact are caring for a patient here. So the classroom has more energy, it's more lighthearted, but it's not necessarily gaming fun. And that's not what active learning is intended to be.
You explained it so nicely about the why behind active learning. Let's talk a little bit about the who and how do you bring students and faculty kind of along for that ride? Some of the biggest challenges faculty faces is student resistance. How would you motivate the naysayers, those students who kind of push back on active learning and faculty feel I'm doing all the right things, but I'm still not seeing that engagement? So how do you address that? Where do you start?
The first step has to be the very first day of class. And in my active classroom, what I did was I started the first day by setting down my expectations of the classroom. And I would be totally honest with students and say, you guys may have heard of this class before and recognize that it may be a little different than classes you've had in the past. But I want to tell you my philosophy of teaching. And when I share that with you, it's because I want you to recognize that the decisions that are happening in this class are made based upon evidence. We expect you as practitioners to be evidence-based nurses. And as an educator, I'm an evidence-based educator. And what the evidence shows me is that you're going to learn much more deeply if we have an active classroom. If you're engaged in the learning, if you are participating in the learning, that is going to create an environment that you're going to learn and retain information more greatly. That's kind of the first soapbox. I kind of set that sound. But then what I also have to do is come up with ways in which students have buy-in. So the next step for student buy-in is I say, okay, as you know in nursing, I test at application levels and higher. NCLEX exams are application and higher questions. Therefore, if you come to class today and I simply impart knowledge by going through PowerPoint slides that reviews material that you had in your textbook readings or somewhere else where you gained this information, and I simply regurgitate that same information for you, you don't get to the process of application. But if you can come to class and you can be applying the information when you're here in class, you're going to take that and you're going to do better on the exams because the exams are based on application. The exams and the test questions I give you are based on the things that we're doing in class. So when you're engaged in class, that you're diving in deep, you're really getting into that information and you're understanding it deeply, that's going to improve your test scores. And for most students, that's right there is what sells it for them. Oh, the classes are going to look like our exams. That's perfect. That's what I want. And the reality is that then your exams do have to look like your classroom. So as you're doing any activity in class, XYZ, you need to make sure that you've got test questions structured around the material, the discussions, the engagement that took place with those activities. But student buy-in truly is a matter of setting that precedence. The other thing that's important, oftentimes faculty will attempt to try some active learning and they'll get students saying, we don't like it, we don't want it. They'll sit in their chair, their arms will be folded, or they'll go to the department chair or dean and say, this is a weird classroom, they're not teaching me what I need to know. That commonly happens. But the instructor has to stick to the plan. As soon as you start to backslide, students will say, perfect, we have control over what happens in our classroom. The instructor no longer has control, so we're going to write the rules. It's really important as an instructor that you say, this is going to be the way my classroom is for the entire semester. So like it, don't like it, that's okay. But this is what the evidence shows me is the best way for you to learn. Therefore, this is how I'm going to run my classroom.
It's encouraging to know that persistence does pay off. And like you said, starting from day one and letting them know that this is how you're running that classroom. Do you have a favorite story of a kind of a breakthrough moment or maybe a student or colleague who was initially skeptical and then tried something and it actually worked or had positive outcome?
Yeah, I started teaching actively, intermittently, a lot of years ago, probably 15 or more years ago. And I started doing some presentations nationally about active learning and engagement. And I would go to schools of nursing across the country and I'd get their faculty involved and I'd show them different activities in order to engage students. And it was great. And I had one person in a session one time raise their hand and say, now, Karin, how much of your class time is really spent doing this type of active learning? Is it 100% of the time? And I had to reflect and I said, honestly, it's not. At that time, it was 50% of my class. I was still lecturing 50% of the time, and I had probably 50% active learning. And I thought, who am I to preach active learning to other faculty, but not be doing it myself? And I decided the very next semester, I was simply going to jump off the cliff and I was going to do 100% active learning. And I was going to stick to that model throughout the entire semester. Now, I had the luxury and the ability to be able to do some flipped classroom kind of concepts in that the students had the ability to see my lecture PowerPoints on their learning management system before they came to class. And I held them accountable to reviewing that material. But when they came to class, it was 100% active. It had lumps and bumps along the way, but it didn't take very many semesters before students were saying, wow, have you been in this class? We are learning so much more. We feel more prepared for nursing. I can't believe how cool it is. And they started talking to other faculty in the department that were not using this format and said, you need to go sit in on Karin's classes. They're great. We are learning so much and we really feel like we're nurses when we walk out of class each day. That process of student feedback and was able to flip the entire faculty dimension in the way in which they were teaching students in the classroom. And it was in fact demanded by the students to make that happen. Not only did I do that on that campus, I transferred to another campus a few years later. The same thing happened there. So it really can very much be student driven when it is done well.
That's fantastic. That's awesome. So let's kind of shift gears to more tactical. Once faculty are on board, the next challenge is really, as you mentioned, designing the activities that are meaningful and purposeful. How do you build those purposeful activities that go beyond the busy work, right? To truly engage those students at a higher cognitive level, to achieve that balance between structure, but still allowing that flexibility. How do you do that?
Yeah, if you can find some simplistic ways in which to apply it, you can replicate those similar types of activities in multiple classes. And as someone starting out, as I was starting out and trying to come up with new and creative ideas, I didn't want every class to feel exactly the same. I wanted different activities in every class. And maybe I'd have this type of activity and I'd have it in the first, fourth, and sixth class of the semester, but I didn't want the exact same activities every single week. So I really started doing reading. I looked at journal articles on active learning, got some ideas from that. I went to conferences, I listened to webinars, and I simply looked at those experts out there that continue to do exceptional work in active learning, and I would pull in additional ideas. And so I may have started with a very small deposit of activities, but that grew and grew over time. And I'd come up with new ideas. I'd wake up at 3 a.m. and I'd have some new idea I want to try in class. And, I was just constantly, it was evolving over time so that every class felt different and engaged and kept the learner feeling like they were going to experience something new when they came into class that day. But use the resources really is the key. Talk to others that are already doing it.
And shadowing your peers, right? I mean, if allowed and able and willing, to be able to see what your peers are doing. It is that distinction between that busy work and brain work that's so important. And that kind of brings us to Bloom's, right? Bloom's taxonomy, a framework that many educators know, but don't always apply in active learning. So what role do you think that Bloom's taxonomy plays in designing these types of activities? Because you kind of mentioned, some of them are lower level, some of the gaming and Jeopardy and such. Like, how do you get it to that higher level?
Coming up with active learning activities to have in class are similar to when you're writing a test item. If you want a high level test item, application analysis level, you have to make sure that the entire test question is focused around the nurses caring for. And if you use the nurses caring for in every one of your activities, then you're going to get it to a higher level of Bloom's. 90% of your classroom activities should be application analysis and higher. And the knowledge comprehension piece, students can look that information up. They can Google it, which unfortunately is what the majority of them do anymore. They can use their online resources. They can find the knowledge, have that foundation. So they've gained that knowledge prior to class, come into class, spend your time applying it. And this kind of reverts back to the other question you asked as far as where do you find activities? Many times you can modify the things you've already got available to you. So have students open up their VSIM, have students open up the materials that they already are paying for and bring that patient into your classroom and have students focusing on the care of that patient. I don't have to sit down with a brand new game plan and invent a new patient. Those patients are out there. They're in your resources. They're in the chapters of your textbook. They are in your online cases. They're in your resources, in your simulations. They're everywhere. So those are the patients you're going to want to bring into your classroom.
That's an excellent idea, right? Why recreate the wheel? You've got the tools, it's a matter of modifying them in some way, which is and like you said, the students are paying for these. So we talked about activities. Now let's talk a little bit about the people leading them because, active learning strategies, I think, it's really isn't just a shift in strategy. It's a shift in identity for many of the faculty. Like, I've never done this before. How do you do this? So I've heard you say that managing a classroom is a lot like parenting. Can you kind of expand on that analogy a little bit?
Yeah, absolutely. So when you're a parent, you know what's best for your child, and they don't always know what is best for them. So when you have students in your classroom, you're the expert educator. You're the one that understands theory around education, and you're the one that understands brain science and how a person learns. So you know what is best for them. So understanding that is the foundation. Setting those guidelines is important. So what are the other things we do for our kids? Well, we communicate clearly with them. We don't play games. We don't try to hide things from them. We try to give them structure in their day-to-day life, just like we'd have structure in a classroom. We make sure that we're not micromanaging them, but we're giving them enough autonomy to learn as an individual person. We're creating teamwork. We're making sure they play well with others. That's an important part of active learning, and having a cohesive classroom is making sure people are playing nicely in the sandbox. All of those components of parenting truly is what you need to move into your classroom. Now, the fact that these are adult learners and they're not kindergartners gives us the ability to use those adult learning theory concepts in order to develop that person as an individual adult learner. And that's an important piece of our facilitation, is giving them the latitude, yet the structure, in order to become an amazing nurse. And it's a balancing act, and it takes time, it takes energy, it takes effort to make it happen, but it will happen. And I tell you what, the reward as a faculty, as you see these people develop into such amazing adult learners, is just very, very gratifying.
I love that parenting analogy. Is very relatable. So, and it speaks to the mindset shift, I think, of the faculty that they need to make. So going from sage on the stage to the, as they say, the guide on the side. So how would you make that shift in their mindset? Do you have any advice on that?
You really have to be comfortable with your material. And you have to establish yourself as, what kind of educator do I want to be? I think oftentimes faculty teach the way they were taught. And the reality is that the way in which we learned when we were in nursing school does not prepare students for the nursing environment. And there are many studies that show us that students are not practice ready. How do we get them to be practice ready as we try to recreate the environment that they're going to be walking into? So it really is a matter of faculty establishing, what kind of educator am I going to be? I think oftentimes we're afraid of letting go of control, but at our core, we're nurses. And as a nurse, we think like a nurse. Therefore, if we run our classroom as if it's a clinical unit caring for patients, we actually are going to feel more comfortable in that environment than we are as an educator, because we might not know the details of the pathophysiology of pancreatitis, and we're afraid that a student's going to ask us a question about that. That's not what students need to know. Students need to know how to care for that patient with pancreatitis. And as nurses, we know how to teach them that, because that's what we do every day. So trying to shift your mindset to, I'm not a teacher, I'm a nurse facilitating people to become nurses. I am not a teacher who's trying to impart knowledge on a classroom of students. Help the faculty to facilitate transition in their mind.
I've heard you say before, and you touched on this, is that we cannot teach how we were taught. That healthcare environment no longer exists. It's very, very different. So if you have a faculty who are ready to kind of dip their toes in, what are some small, kind of low risk ways to get started? We have a lot of new nurse educators coming into academia. Where did they start? Where did they begin?
I see as you begin to transition into your classroom into an active environment, there's really, I think, 3 different ways that you can make this transition happen. First of all, force yourself to incorporate activities into class and set yourself with specific guidelines. Like, I will use one active learning activity for every 30 minutes of class. So if you are tied to your PowerPoint, you feel that you have to lecture, you know what, for every 30 minutes within that lecturing, there has to be at least one active, engaging, high level, thought out activity that students are participating in. That's one way to do it. The other thing is to turn one class into active. So you might have an entire semester of, 13 weeks, 14, 16, whatever it may be. But one of those or two of those classes are going to be 100% active, where I'm just going to focus on this particular content. I'm really comfortable with it. Let students know ahead of time that transition is going to happen, or they're going to come into class going, what the heck is going on here? Let them know that this is our special day in class because we are going to apply 100%. Give that a go and see if that feels comfortable. And maybe next semester you can have 2 classes like that or 3 classes. And the third way is, of course, the age old, just rip the Band-Aid off and just flip it. Now, I like to warn faculty. And in fact, I'd mentioned earlier, I had one campus and I got all faculty transitioned to active learning, moved to another faculty. And when I went to this new campus, and I went to my director and I just said, okay, I just want you to be aware. My teaching style is different than most faculty. I'm 100% active. I like to use the scrambled classroom, flipped classroom, whatever concept you want to use it. But I said, I also want you to know there is going to be some kickbacks and my initial evaluations are not going to be good. She's like, you know what? I support you 100%, Karin. I trust you. Go for it. Well, within 2 semesters, the evaluations were back where they needed to be, but it was a transition for this campus. And eventually everybody took off. So knowing that ripping that Band-Aid off sometimes can have a little bit of pain, but you're going to get that huge feedback from students who saying, oh my gosh, I learned more this semester than I've learned my entire program of nursing school, or I feel more prepared for nursing now than I ever have before, or I taught 3rd semester, they'll go to 4th semester and say, you know what, you got to do what she's doing because we learned so much last semester and we really feel like nurses after walking out of that class. Those are the things that you need to keep as your barometer and the direction that you want to migrate towards, that the rewards are there. You just got to stick with it.
It gets me excited. I want to take your class.
I'd love to have you.
So, Karin, before we wrap up, we always like to kind of end with a spark, that kind of pearl of wisdom that listeners can carry with them. So what's one spark you'd like the listeners to remember about today's episode?
One of my mottos that I like to use with students and always tell them, this class today was hard, guys. I appreciate you sticking with me. You have really worked hard today. You've been engaged. I'm really proud of you. And this is hard work. But my motto is if you walk out of my class today and your brain does not hurt from thinking so hard, then I, as an educator, have not done my job. Because my sole purpose in that classroom is to make them think harder than I am thinking. They need to exercise their brain muscles. They need to work them hard. So make your brain hurt. And I loved it because when I would come out of class, the end of class, they would just kind of put their books in their bag and pack up their computers and say, okay, Karin, you did it. My brain is hurting. I'm like, woohoo, that's a win.
Mission accomplished.
Mission accomplished. That's right.
I love that. That's fantastic. Karin, I want to thank you so much for, sharing your wisdom and your passion with us today. And your insights really remind us that active learning, it may feel uncomfortable at first. And you've given us a lot of food for thought on strategies and where to begin. But it's one of the most powerful tools that we have to truly engage students and elevate their learning. So, and to our listeners, stay tuned for part 2 of our series with Karin, where we will flip the script and explore active learning from the student's perspective. So until next time, keep teaching boldly and learning actively. Again, thank you so much, Karin.
Thank you.
Thank you for joining the Lippincott Spark Illuminating Nursing Education podcast. Enjoy this episode, subscribe, share, and leave us a 5-star review. For more information, click on the link below to learn more about Lippincott Nursing products and services. Until next time, keep leading, learning, and making a difference in nursing education.